Hello, everyone. Welcome. We're in season 2 of our Public Health Plus series. As Diego said, my name is Michelle James, and I am the Senior Director of Alumni Engagement at the Rollins School of Public Health at Emory University. Our Public Health Plus series was created by the Rollins School of Public Health Alumni Board's Career Development Committee in partnerships with our very good friends at Arch Sparkleball to examine the spaces where public health intersects with other disciplines. Our goal of the series is to highlight those working at these intersections, discuss their work, and then broaden our thinking. Today, we're exploring the intersection of public health and homelessness. Between tumultuous economic landscapes, failing social safety nets, and limited housing opportunities, homelessness has been on the rise in increasingly visible ways, according to the Alliance to End Homelessness. It is a complex issue. But what if the solution was actually pretty simple? Give people housing. Facilitating our discussion today is Sophie Becker. She is a design strategist who joined Orange Sparkleball after being a design apprentice with her sister organization, SparkCorps. Sophie has a particular interest in how design, innovation, and public health can all work together to drive progress in systematic challenges. Her current role with OSB, Sophie focuses on strategy and communications for community networks and public health innovation projects. Our special guest today is Dr. Sam Tavares. Dr. Tavares is the CEO for the Pathways Housing First Institute and a clinical associate professor at UCLA Department of Psychiatry and Biobehavioral Sciences. He originated the Housing First program to serve individuals with mental illness and addiction experiencing homelessness. Housing First is based on the belief that housing is a basic human right, and research studies on the program's effectiveness report an average housing stabilization rate of 85%, with improvements in a participant's quality of life. As a result, the Pathways Housing First program is currently being implemented across the US, Canada, European Union, Australia, and New Zealand. We are honored to have you with us today, Dr. Tavares. Sophie, thank you so much for facilitating this discussion. I'm going to let you take it away.
Awesome. Thank you so much, Michelle. And thank you everyone for being here. I know this conversation is really dear to my heart, and we had hoped to have Sam actually this summer for a talk, but some things came up and we weren't able to. So I'm really excited that we are able to get together today and talk. So as Michelle said, Sam, you are both a professor and the CEO and founder of Housing First Institute. But I would like to take an even further step back and ask kind of about your career trajectory. How did you get into the work you're currently doing, and what was that path like?
Well, thank you, Sophie, and thanks very much for inviting me. I'm very honored to be a guest here. Public health is something that is near and dear to my heart, and so I appreciate the opportunity. There are some people that have a career trajectory that, when they were 7 years old, they've always wanted to be an artist or a doctor, and they kind of pursued that. My own career trajectory was not like that. It was not linear at all. I was born in Greece, and so I immigrated to Canada and then eventually to the States. So in understanding the cultures I was in and what opportunities there were, I think that had a lot to do with shaping my own thinking about what is possible to do. So there was a lot of adjustment and just figuring out languages and things to do, let alone like, where am I going? I've always been a worker, so that my parents were in the restaurant business, and I just narrowly escaped a career in the restaurant business. I had to kind of almost like run away from home not to do that. But because I pursued literature in college. I went to college in Montreal, and literature was something that just was transporting and opened up so many different worlds. I was really just following my own interests at that point. This is a time also where this was the 1960s. I'm very old, so like culturally, it was a time of exploration, and there wasn't as much, I think, economic pressure to find a career that would be that would pay. That would, like, what are you going to do for a living was not the most important thing. It's like when you find happiness was more the and by the way, you can do both, so no worries. But from literature, it was difficult to explain to my restaurant running parents, like, how does that translate? And so psychology was a companion to literature. I mean, most literary characters are kind of studies in personality anyway, and so psychology was just not as literary, not as poetic, but a similar and interesting, very interesting approach. So that's how I got into psychology, right there at the end of college. And I wasn't wild about it because it was kind of like a compromise from literature. But I taught for a few years, and this is where I think my interest in the way people cope with life was sparked. I was teaching special education one year, and it was a class that one student at the time or another. And the students that would come in had all been diagnosed, long before I got there, with learning disabilities or attention problems or all kinds of ways that they were being challenged in the school system. And what was most intriguing to me was not so much the problem that they were having, but their attitude towards the problem. Some would come into the room, the classroom, and they wanted the door closed. They didn't want anyone to see them there. Others would come in and say, well, look, I go to hockey clinic, I'm coming to a reading clinic. It's like no big, like same diagnosis, same issues, but their own relationship to what was going on was very, very different, depending on their own, I guess, sense of how it defined them or didn't define them. So I thought I better learn a little bit more about this because I was over my head. And that's when I decided to go to graduate school in psychology. And, I was already in my mid-20s at that point. And I think that's, and I feel like I found something there that was totally amazing and interesting. And that's how I got into psychology. It's been very rewarding because when you're doing something that you just have a natural interest in and you love doing anyway, that I don't feel like I'm going to work every day.
You were no longer reluctant about psychology. It finally had grown on you. That's
yes.
Great.
Yes.
So then you have your PhD in psychology. How do you come to found the Housing First Institute?
Yeah. Well, to get a PhD in psychology, you have to do an internship. And I was working at that time in New York City at Bellevue Psychiatric Hospital, the famous Bellevue of the hospital that, people get threatened, I'm going to send you to Bellevue kind of thing. It's been around since the 1800s, late 1700s. And it was an inpatient service. This is now, we're talking about 1980. Reagan had just been elected president. And I'm working on the inpatient service, and the transformation in our country in the early 1980s was dramatic because I don't know how many people on the call even were born in 1980, but one of the first things that Reagan did as president, there was an air controller strike, and he fired a presidential intervention at a union level, fired all of the air controllers in the country. I mean, this was like the announcement that there's a new sheriff in town and what it had to do with labor relations and unions and everything else. neoliberal economics was in the house and they were there to stay. And they have stayed, by the way, the same economic policies that Reagan brought in. Let's downsize government, let's reduce taxes, trickle down theory is all of the pretty much the same. The Biden administration is trying to reawaken government in some ways, with these big bills to kind of bring some more active role. But this is just today, so for the last 40 years, we've had this government. And the other thing that Reagan did soon after the air controllers were fired was to reduce the budget for the building of public housing in this country, slashed it by about 75 or 80%. We were building public housing. There was, some controversy about whether it was the right way to go or not, but there was lots of affordable housing for people that were not making enough to pay their rent. It was subsidized. And he cut out that program. And people warned, if you cut out the building of affordable housing, we're going to have homelessness. We did not have homelessness as a word, did not really exist before that. There were people that were considered vagabonds or hobo. There were different terms for people that were not. It was a very small number also. And, the Hooversville tentings in the Depression area, they were called, they were named aptly after the president that created it, kind of thing. Well, not created it, but was in office when it happened. But anyway, homelessness became a term in that time, and people in fact began to be on the street, literally on the streets. It was something that, having lived through that, like to be going through, day after day, walking to the hospital and back and seeing more and more people on the street, especially those that I had met on the inpatient service, were now out on the sidewalk. So then it became like not some anonymous group of people that were there. This was like the people I knew from just a couple of weeks ago. And I moved out of the hospital job to take a job with the city of New York to do street outreach for people that were homeless and had mental illness. It was a specialized program. I was just, drawn to do something about what was going on the streets. So that's how I first got into homelessness. I was running this outreach program for the city of New York. Quite different than Housing First. It was actually more like Hospital First, in the sense that it was an involuntary program. And so we would visit people on the sidewalk, interview them, and if they presented a danger to themselves or others, we would take them to the hospital involuntarily. And often the people that were transported involuntarily, it was not so much that they were that their psychosis was or their delusions were the problem. They typically had physical health problems, coughing up blood, pus oozing out of their sneakers, really horrendous, neglectful things of street life. So we would take them to the hospital, involuntarily, hoping at least to help them with so they don't die, on the street. I did that for a few years. And what began to happen was this pattern of returns. After all this anguish and taking someone to the hospital, a month later, they would come back. And it was so frustrating. And it felt like there was nothing to do. Like, what more can we do? People didn't want to go to a shelter. The shelter industry was getting larger and larger at the time. We thought homelessness was just this crisis and we'll build a few shelters and then, we'll figure this out and then we won't need the shelters anymore. Well, we were wrong about that one. So, here it is, bigger and bolder than ever, and more shelters and more homeless people. So the change, I think how we got to Housing First was we kind of threw our hands up and said, another trip to the hospital is not going to do it. More pleading for referrals won't do it. We thought we'd try this radical idea of, why don't we ask the person who's homeless what they want? Maybe they have an idea of what we should do, because we all of these like highly educated people can't really figure it out in the current system. And so we said, okay, instead of standing around and talking about them, said, why don't we ask Charlie what he wants? Charlie, do you have any idea? Like, what's your sense? Like, how do we fix this? He says, isn't it obvious? I need a place to live. Like I just simple, decent. How about that? A place to live. And why were we blind to that? Why were we blind to that simple and obvious truth? It's because people who are homeless and poor do not control the narrative. The narrative is controlled by the media, and the media is owned by Murdoch and Bezos and people that have a stake in keeping the system, in a particular way. Not, it's not like connect the dots. It's just the culture of, how capitalism works. So the narrative for people who are poor is that, they're there because they want to be. In fact, Reagan said, I think many people are there by choice. There's a clip of him saying that over and over again. But you have to watch PBS a lot to get that. There's also a biography of Reagan, by the way, where they correctly attribute the beginning of homelessness to him. But anyway, the narrative is that people are lazy, people are making bad choices. It's because of their mental illness. They are severely addicted. All of those characteristics about the person, so that it's somehow their fault for being homeless, which is, if it's their fault for being homeless and they've made bad decisions, we too, in the mental health and health industry, are subject to those same biases. So it's like, why would you ask someone their opinion if this is what you've been kind of inducted to believe about them? So you have to kind of tear away the propaganda, and understand that it's inaccurate. It doesn't represent the people that we're actually talking about, because when you talk to people, you see that they're struggling very hard. They didn't make bad choices. Circumstances were they're on fixed income, the rents are too high. There's, the fact that public housing has been cut, that rents are going through the roof, that wages don't even pay enough to get a first month's security deposit and rent down payment to get in. If you ever get out of housing, you can't get back into it. Like, these structural things are not what is being talked about, Also, what's not being talked about is the fact that why were people discharged from hospitals to the street without a decent discharge plan? Why do people who get arrested for taking public transportation without paying their ticket get arrested and then go to jail and are discharged back to the street now with a criminal record that would prevent them from getting public housing? There's so much that's broken and contributes to what we call homelessness, that in many, many ways, the very word homelessness is a cover of the real problems that create it. And so we're not, it's another way of not looking at the systemic issues, because we're still calling it homeless and still pointing our finger at the population that is the victim of all these failed systems, rather than pointing the other way around, That's a very long-winded way of saying you got to listen to the people you're working with, because they know really what's best for them. And not only that, but you won't have to persuade them to go to the shelter. People say, why are they still out there? Why do they go to the shelter? It's like, well, if your choice is go to the shelter and be in a crowded setting, if you are anxious, or, if you have some vulnerabilities, you don't want to be in a crowded place that's, with no space. You'd rather, it feels safer to be on the street. They're choosing to be on the street, people say. Well, no, they're not choosing to be on the street. They're choosing not to go to the shelter because that's too frightening. But if you gave them a better choice, like housing, a place of their own that's safe and secure and affordable, they would take that. So that's what we found. We found that if you listen to people, they want housing. Almost everybody says that. And they don't want housing where they have to be clean and sober, change themselves, take medication, come in at this time. They want like housing where they could just go and have the freedom and privacy and self-determination, that they can decide what to watch on TV and when to eat, like the rest of us, just housing like the rest of us. Whether you're mentally ill or whether you're using or not using, you still have the same fundamental need for housing, So that's why the program is so popular and why it works so well, because Housing First offers people that option right from the street as a way of getting them out of the misery and vulnerability and terror of being homeless.
Yeah. There are so many things I want to respond to on that, because that was a fantastic thought. In particular, I know the kind of false narrative around shelters is something that I think a lot of people who are housed have never really thought about. I hear that narrative a lot of like, well, we'll just build more shelters and that'll solve the problem. But it's like, yeah, I mean, you don't even like I live with my parents, and I don't even like feeling like, oh, there are rules here. But it's like people I know and grew up with, and everyone needs that right to self-determination and ability to make their own choices. And not even to mention things like families get split apart in many shelters, and like if you have an animal, often not allowed. And we're living through a pandemic that in and of itself is a huge thing, that shelters are very not sanitary.
Well, that was one of the most interesting things about the pandemic, because I have been yelling for like 25 years, let's get people in a place of their own, like that's what they want. And like, here comes this pandemic, and it's like, oh, let's get people in a place of their own right away, because it's unsafe, to have them all crowded like this. It's true, it's been unsafe forever, but the virus kind of really pointed it out in a way that we hadn't been able to before.
Yeah. So, I mean, do you feel like a little positive about that in that regard, or do you think people will quickly?
I think that, it was a good thing. Did people connect the irony of that? I don't think so, but maybe I think there has been in some states, I know here in California, because one of the reasons that worked so well for many people is that not only was it safer for people who are homeless, was safer for the rest of us too, in terms of not having one group that's going to take up all of the emergency beds and respirators, so like it was like allowing for more use of the resources by doing something preventative. But it was also economically very smart, because these hotels and motels were going out of business, and the government, wisely paid up the rent so people could be housed like that. And in some cases, the hotels, especially the motels, never went back. And so there's a huge, in California, I think like there's a projection of doing something like 30,000 or so motel conversions to small studio apartments. So it has created this bubble of, new affordable housing. So that was a great kind of after effect of that policy.
That's one bright spot that makes me feel a little better. You started touching on something there that I know we've discussed on our previous phone calls, but I think this idea of it benefits all of us if we help the most vulnerable amongst us, but that's kind of not the narrative that we see, and it's not kind of our gut reaction. Could you speak to kind of that idea of Housing First is really, it benefits everyone? I think some people see it as like, that's not fair. And that's a very, dare I say, American idea of kind of like, well, I had to work for it, you should have to work for it.
Right. Right.
Do you think that is one of the biggest challenges, stopping Housing First, or a minor one?
No, I think what's stopping it is more the latter thing you said, which is, we don't really have, we don't really have a consensus about what to do, is actually our biggest problem. So like even with the pandemic, we're still going through this right now. Like in the last federal administration, they were, totally of the conservative mindset, which is, let the states decide, let the cities decide, and especially let every individual decide, this idea that government should not be in the way, okay? That's not a good strategy for a public health problem any more than it is for homelessness, which is a public health problem. So in the states where there was no attention paid to the science, it was all politicized, people were dying, and people are still dying in Texas and Florida, So where you have a federal mandate and a state mandate and a municipal mandate all lined up, and we're like checking vaccinations and, wearing masks indoors, taking all of the precautions, the data shows like, we're having an effective intervention there. But the same is exactly true with homelessness. You have people arguing that shelters are the way to go, or this kind of specialized housing where only people who are homeless and mentally ill should live. And you have other people like myself saying, no, I think people with supports should live in the community like the rest of us. It sort of depends on what is our vision of our society, and what is the place of people with mental illness in it. I would say, if you take it out of the conversation of policy, most people with mental illness are living with families if they have their support and resources, or most people who have mental illness are not homeless. It's like, so this idea that the mental illness causes homelessness is bogus just on its face value, because there's many millions of people who manage, cope, are in recovery from severe mental illness. Homelessness is only about poverty. But we don't have an agreement about what to do with poverty. Even now, we're looking at child tax credits. Conservatives want to put a work requirement onto that, like a single parent mom has to work in order to get a little bit of, like there's no consensus. We don't have a consensus about what to do. This is why our homelessness issue is worse than it is in Canada, in Europe, in Australia, New Zealand. Those countries have fewer homeless people per capita, and they have a bit more of a coherent. Scandinavian countries have actually ended homelessness, because before they talk about a program, they say, let me tell you about the Nordic contract and the way we see how people should live in our society. We think those who have a lot should pay more taxes and those who don't should pay less, and we should all take care of each other. That's how they begin describing their housing programs. You know what I mean? It's like, it's in a context. So we don't have consensus is one. The biggest challenge is like, what is going to be the role of government? Because this is actually in the scheme of the US economy. When you think about things like a defense budget, this is a tiny amount of money. It's not a lot of money. We're talking $40 billion would end homelessness in America, like tomorrow. But we would also have to think about, we want to change the tax structure, we want to change some control over real estate, we want to up wages, because homelessness is not a fixed pool of people. It's the people who have not done well today. If we don't fix those other things, we're going to have more homeless people, because we're generating homelessness at a faster rate than we're ending it. So, the numbers are always going up, which is confusing to some people. How come, we housed 5,000 people in Atlanta last year? How come the numbers went up? Because we created, another 1,000 people that weren't there last year. So it's like that, And so we don't have consensus. We don't have a commitment to take on the problem to scale. And so what keeps happening is we fund a few more shelters, fund a little bit more housing, a little bit, it's not, and it's like a zero-sum game, because this is the budget we're going to allocate for homelessness. It's a question of how we divide it. Well, we really need to change the conversation and say, no, actually what we need for homelessness is much, much bigger, because, if you don't, you have a criminal justice system that is holding people in a jail cell for $750 a day because they have a $5, ticket for turnstile jumping or something. Or you have people going in and out of hospital 4 times a year, which costs $60,000 for those 4 hospitalizations where you could pay rent for like 4 years with that, you know? So it's not that it's going to cost a lot more money to end this problem. It's like we have to rethink, you know, how we're actually spending the money. So why should someone get a free house? Well, because if you actually give them housing, you're going to save your money as a taxpayer, not paying police, courts, jail, hospital, detox endlessly, which is actually more money. And the person is still out there getting sicker year by year. So it's a lot.
Yeah, I know. I think Finland, I've seen most recently. I mean, I've done a lot of reading on the Finnish housing first model, but they have crunched the numbers. And I think some states have as well, to show that the economic argument that it actually, you save money in the long run, which seems, I think, so counterintuitive to folks, but the way you just described it is perfect. So to all that point, what can we learn? What countries, you've mentioned Scandinavia, and I know there's some other countries doing this, but who is doing it well? And do you feel like there's anything we can learn, even if these challenges that you just outlined still exist?
Yeah, I mean, there are countries that are doing it well, and I'll talk about them in a minute, but there are things that have happened even here in the States that have been really promising. And so we have examples of what to do, that all we need to do then is take it to scale, you know? I'll give you 2 examples. One is with the veterans. Now, back in 2008, 2009, we do an annual, what they call point in time count in this country. So we count, you know, in the middle of the night, how many people are in a shelter or on the street. And they discovered there were about 75,000 veterans who were homeless. Well, it was the Obama administration, so there was a little bit more kind of a consensus at that time that, but both Republicans and Democrats thought, we can't leave our veterans on the street. And they allocated housing vouchers, so the rent would be taken care of through HUD. And they allocated case management dollars through the Veterans Administration. So that, and they, you know, it was a bill that was unanimously passed for, you know, many millions of dollars ongoing to take care of these veterans. So each community among their homeless identified veterans and did outreach to them. Where we are with veterans today is we've cut that number by half, you know, mostly on the East Coast cities. There's 82 cities right now that have ended veterans homelessness, 82. So, you know, that to me, that's inspiring in that if we have an idea, we have consensus, we're going to deal with this population and put the resources in place, we can do this, you know. And similarly, communities have identified people who are what they call chronically homeless in the homelessness field, which are people that are homeless for years or in and out of homelessness for years. And counties, Milwaukee County most notably, has coordinated between the county and the city, also the business community, the faith community, and the courts, you know, police and criminal justice system, the DA, are all working together to get people who are chronically homeless off the street. The DA actually walks around with the outreach teams, and if the person has a warrant or an outstanding warrant that is keeping them from being eligible for housing, the DA adjudicates it right there on the street, or sends them to a judge every Wednesday where the warrant is just you know, removed from their record, you know, because it was obtained during a time that they were homeless. But they're eliminating all of these barriers to housing and getting people. I think they're down to like 19 people or something on their last count. You know, I mean, they're doing a tremendous job. And both of those examples for me are consensus, you know, with every stakeholder in the community, and then the resources to put the housing solution in place and then operate the housing. I mean, both of these examples I described use a housing first approach, which means, you know, you put people in housing first and then you provide all the treatment and support, because otherwise, you know, you are going to be investing in transitional housing and treatment and which is okay. I mean, that works about 40% of the time. But like you said at the beginning, this other way works about 80% of the time. So it's a much quicker and more effective way of addressing the problem. So we know, the issue, Sophie, is not that we don't know what to do. The issue is, how do we explain this to the public so there's a sense of urgency and an understanding that we have to advocate for something so that we can get it done. That's what I need your help with.
To that point, it's making me wonder, when was this Milwaukee example? Was it after the book Evicted was written, which particularly focused on housing?
Yeah, no, this is happening right now in Milwaukee.
Okay.
Yeah, I mean, I don't know when they got down to zero on veterans, like 1 or 2 years ago, maybe more. But not only have they reached this zero, really, but they're sustaining it. That's they've managed. Now they're thinking about prevention to stop the inflow. Mm-hmm. So yeah, no, it's very current.
Yeah, I wonder if that book was kind of a catalyst for kind of community level consensus and urgency to work towards that.
I think that book opened up a lot of people's eyes into like the entire eviction industry, yeah. And it was just fantastic. It's like right on the threshold, like for the people that we see on the street, there's probably 20 or 50 people that each one of those people on the street represents, that's just kind of hanging in, like maybe navigating from one eviction to the next, but the next one will be the one where they end up on the street kind of thing. Because there's what they call the precariously housed, so for every homeless person, there's a lot more people that are precariously housed or living because their relatives, are kind and they get along.
Yeah.
So there's a lot of imminent, and there's a lot of conversation about that right now, especially with the pandemic, having a rent moratorium, and that's about to be lifted. And there's a anticipation that there's going to be a lot more homelessness once these moratoriums are lifted. So, it's all of that is a lot about economics. I mean, I think that, and I guess for me, I got into homelessness because I was interested in helping people with mental illness. So for me, it's always been about a subgroup of people who are homeless, just this group that has, severe mental illness. And the exciting part from a psychological perspective is that we've been wrong about the definition of mental illness. The whole diagnostic categorization system we used is flawed. That people can have severe mental illness as a diagnosis where they're hearing voices or have particular delusional beliefs, but it's not related to their ability to function. To me, those are some of the amazing things and sort of pushing against the whole way that the mental health system treats people with mental illness, almost as if like their intelligence is compromised or their judgment, like they don't know what they like, is another battle in this, which is really, people have strong ideas and opinions and capabilities, even while they struggle with these other symptoms. And I think putting people into housing and supporting them to have their own apartment is sort of at the extreme of that, because like for many, many years, the belief was that people with severe mental illness needed to be in supervised housing and, someone needs to take care of them. And we've just been, in a very exciting way, completely off about that. And people are so much more capable than we, they've been kind of had the reputation of being.
I do just want to note the book I mentioned is called Evicted by Matthew Desmond. It's really good. I'd recommend it. It really changes how you think about the housing system in America. But I do notice we are coming up and I want to save a little time for question and answers. I see we already have a couple in the chat. But I do just want to ask you one last thing, even though I have so many more questions that I wasn't able to get to. But since this is obviously about public health, and that is a lot of our audience, what would you recommend for folks who work in the public health sector, or people who are studying to get degrees in public health? What would you recommend for them to think about, and what actions they could take to kind of help work towards these solutions?
That's a tough question. I mean, I guess I would say that if you're looking at homelessness, to be aware that whatever you're reading or learning about it, you should think about what is the point of view of the author, or where is this evidence coming from. That we need to be very critical in the review of what is being said about homelessness and who is saying it, so that we can operate from a position of actual information and data, from a scientific perspective, because this is an issue that's particularly vulnerable to being politicized, as is, climate change, for example, like other huge issues, as is COVID-19, right? So just know that homelessness is not simple. It's people talk about it from many different perspectives. So definitely that. And I think that there's a lot of information about homelessness. It's one of the things that America does best on homelessness is keep data, which, for better or worse. But there's a lot of good information about homelessness from a research perspective. So, be informed that way. I think that if there's lessons to take away lessons, is that we have a homeless system that is fragmented and heavily invested in particular points of view. And if we're going to work towards solutions, it has to be a multi-sectorial solution, that kind of refer to that and saying that homelessness is really an obscuring term. When you're going to be working in homelessness, you really need to think about bringing in certainly the mental health system, certainly the criminal justice system, the business community and the faith community, and government, of course, at each level, because all of those systems either contribute to or are impacted by homelessness. So that if you're going to really think about a large-scale solution, those stakeholders need to be engaged.
Awesome. So I'm going to turn it over to some of the questions we have in the chat. Judith Samuels asked nearly 20 minutes ago. So Judith, I'm sorry that we have been ignoring this one, but they write, Sam, did you think we would have made more progress by now, given that the science we developed in the 90s and early 2000s supports housing first? What could we and should we do to turn this around?
I'm sorry, I missed the first part of that.
Did you think we would have made more progress by now, given the science developed in the 90s and 2000s supports housing first?
Yes, Judith, I'm glad. It's nice to have you on the call. I'd be interested in your opinions about that, as much. I guess I've been kind of stunned at how I thought once we figured out that we could do housing first, we would just end homelessness. I was very naive. It wasn't something that was so welcomed by the shelter community, for example, because they correctly anticipated that, if we do this, we're going to be out of business. So I didn't expect a level of resistance at all. But there, what gives me hope is, the two examples I mentioned nationally, and there are many others, that programs convert and organizations convert, and then seeing, across the ocean, entire countries converting and what is possible. So that, it's not theoretical. We know it can happen. We've seen it happen in other places, and that's very, very hopeful. But yes, I mean, it's been incredibly frustrating to know that we have a solution and we can't muster the political will to bring it to scale.
And Judith, feel free to unmute yourself if you have any other thoughts or anything else you would like to share.
No, I think we were all naive. And, like in New York and a lot of other cities, the problem just keeps growing. And even though the solutions are sitting in front of people, but it's important to hear your voice and to keep your voice strong in the mix as we try to really address this. But I do think that linking it closer to healthcare is a positive. I think getting more people in the healthcare sector to be interested in solving the problem and using the tools is incredibly important. So I'm grateful for that and for this forum.
Awesome. Thank you, Judith.
Sure.
Okay, Katie Riley. Got a lot of writing here. Last year, I was in Jacksonville, Florida, and the city created a plan to move 100 homeless individuals to hotels for a few months, but did not have a plan after the months passed. How can government and cities make the homeless first, or make housing first an actual vision? I know the specific program got a lot of negative reviews from the individuals experiencing homelessness since they were kicked out of tent cities and not provided enough support. It was heard that the city only wanted them in the hotels so they could gentrify and clean up the downtown area of the city.
Well, not just out of the downtown area, but it also probably saved the hotel from going under because the city paid a lot of money to have people housed there. And that was Jacksonville, Florida. And I can tell you it's in Tulsa, Oklahoma, and New York City. And that's what happened. That's what happened during the pandemic. We understood that the infection rate risk was much, much higher having people in congregate settings. And we moved very quickly to put people in rooms of their own. And there was it's similar to the shelters. There's, most shelters get opened up and there's no exit plan. It's like, oh, we're a shelter. And they expect to be in business for many years just being a shelter. So I think, one thing we've learned is that if you are going to, we don't have a consensus about this, but if we did, it would be something like every program that is serving people who are homeless should have an exit strategy of how they're going to get people housed. Because the reason they're in business is to help people who are homeless, not to stay homeless and manage homelessness better, but to get housed. It was a great example back to Milwaukee. I just learned about this last week, another innovation they had. Because, shelters don't want to go out of business. There was a faith-based food program that would give people who were in encampments and on the street meals, right? So now, it was like a whole huge community of volunteers, very caring, it was very loving, And then they didn't want to have this program or this community be disbanded simply because people were now being housed. So they met with them and converted the program into a home delivery of meals. I mean, people are still very poor and very much appreciate a good meal. And the connection to others is huge. So this whole program that used to go around in trucks to the encampments is now making house calls and delivering meals to people at home and spending a few minutes visiting with them and talking with them. So that, if you have the vision, things fall in place. I think when people were put in those hotels, there was no vision of what would happen. There was this idea that everyone would get a voucher and then they would be placed in permanent housing. That was the promise, but it was a broken promise for more people than not.
Awesome. If anyone else has any questions, feel free to put them in the chat or unmute yourself and ask. I'll give it a minute, but I know if no one else does, I have some more questions, but I've been hogging the conversation. Awesome. We have one from Nancy Burke. Anchorage, Alaska had a positive outcome of the hotel strategy where we previously had neighborhoods opposing housing. Yes, housing for the homeless people was not popular. However, the hotel program demonstrated that when people had housing, they did well, and the neighborhood wasn't even aware of the housing program with over 200 people. The community learned that housing is a part of the solution, and now that community is investing in housing. Awesome. So that wasn't really a question, but a great success story.
Yeah. Thanks for sharing
Sure.
that, Nancy. That's great.
Awesome. Well, in case anyone else is typing or thinking of questions, Sam, are there any books or any media narratives that you would recommend if people want to dive into this?
Yeah, I was gonna ask that, Sophie, too, because I was interested into bringing.
Allowed to push my own book.
Oh,
Housing First. It's Deborah Paget's the first author, Oxford University Press. And it kind of tells the story of the Housing First program that I just sort of told you, like from outreach to the first programs. It also summarizes a lot of the research that was done. You know, it's like that. It's a good summary of where it is. There's lots of stuff on homelessness that is, you know, mostly though, and more than books, I would say it's in the journal articles and you know, the current research.
I know we are coming at time that we normally would go into breakouts, but I do want to just ask Ledis's question because it's a really great one. She asks, you mentioned that consensus surrounding being on the same page is critical. So how do we go about building consensus in communities that are divided on how to address homelessness? Just that simple question.
Yeah. You know, how do we go about building consensus in communities that are divided about how to address gun control? How do we, you know, you take that stem and like you just fill in different things, you know, climate change. But I think that the how do you build a consensus? I guess you start, you know, like small group movements. You know, this is like in a quiet way, you know, the way that you would start any revolution. You know, you get other co-conspirators that are like-minded and build your consensus. Initially, having a consensus among a smaller group of people is easily, and then you incorporate more and more of the community. I think, you know, if I could go back to that Milwaukee example, it started with the city housing authority and the county executive, just those two talking about we have to do something, that problem is getting worse. And, you know, building more shelters hasn't done it. You know, Milwaukee's a very cold place, and so no one can be left on the street. But the more shelters they built, the more homeless people there were staying in shelters, and they shifted to this housing first approach. So they started from the housing authority giving people vouchers from the street. And once they had a little momentum, you know, then mental health comes into it. Then the police come into it, because the police are on the streets all the time. They're an excellent source of referrals. So rather than policing the homeless, for example, they had the police agree to call the outreach team when they were thinking about arresting someone. So they wouldn't take them to jail. They would refer them instead to an outreach team. So, you know, it started out with these two housing related groups, then now criminal justice is involved. Hospitals won't discharge someone with mental illness who has a homelessness status going in until they call this housing specialist team to see if they can get them into something quick and then an apartment eventually. So that, you know, and that's a model that you know, I think, you know, whether it's a political movement or a public health movement, you know, you start with your core group of allies, and then you build and include the other stakeholders in a new way of working together for an alliance that is, you know, a shared goal, which in this case would be ending homelessness.
That's a great example. I know I'll toot the horn of an organization. I'm in Eugene, Oregon at the moment, and we've had an organization here, actually, I think since the 80s, called Cahoots. And they have always been, they've been crisis response, but instead for, you know, examples of people having mental health crises, or, you know, if it's just someone loitering, or, you know, all the many silly things that people call the cops for, they respond instead, and it helps, you know, not waste unnecessary money or put people's lives at risk. And they've actually, a bright spot has been, they've had a huge influx of inquiries of how to set up similar systems in different cities across America since last summer and a lot of the Black Lives Matter movements. So that's something that I in particular feel optimistic about and hope to see communities stay interested in. I will just note, I know I had said we were going to do breakouts, but I've been getting some messages of consensus that people just want to stay in the group. So with that said, if anyone has anything else, feel free to unmute. It doesn't have to just be me reading questions, and I know we all have a lot of things to ask. So we'll just stay in this group for another about 10 minutes or so.
Yeah, the next few minutes is for everybody just to participate, give any thoughts, reflections, insights about what you heard today, which were really, really great questions and answers. Thank you both for doing that. So if anyone has any other question or wants to share something that is happening in their community that is relevant to this, please feel free to do so. This time is just for us to, share some of those thoughts and experiences that we might have had in the past.
Hi there. So I was kind of just curious about, I guess, your perspective on really defining homelessness and what that means. I used to be a teacher, and a lot of my students would be in situations where they were living in hotels, or, it was like 5 families living in a 2-bedroom home. So I guess I'm just curious on like what your perspective is on like how we really define what homelessness means. And the kids that were living in a hotel, it was because they got evicted from their home and that was the only place they were. And they were there for a month or 2, and then they would go to a different hotel, like just kind of moving around.
No, thanks. That's I'm so glad you raised that, because I think that I didn't really clarify this very much. I'm talking about people that are on the street and highly visible, the group that has all of these additional problems besides poverty or struggling to pay the rent, which is what you're describing. And so I need to say that the group that I'm talking about represents maybe 15 or 20% of all homelessness. So it's a very, it's a significant, because of all the different ways that it intersects with other systems. But it's not really the representativeness of homelessness. Homelessness is really more what you're describing. Homeless families, which Judith Samuels knows a lot about, and others on the call too. But homeless families and individuals, those individuals staying in shelters because they're poor, they're working, they're working some minimum wage job, and they can't get out of the shelter because they can't put enough money together to put the security deposit in first month's rent. That group is about 70 or 80% of homeless people. So that's actually what homelessness is about. It's about, low wages, high rents, and poverty. Mostly about that. But what's strange in the conversation is that when homeless gets talked about, it often gets talked about the way I'm talking about it, by people on the street, because in the public mind, you happen to have had an inside view as a teacher with the kids that you're working with. But in the public mind, homelessness is this 20% that's on the street, because that's what they see. Because the people you're talking about are invisibly homeless. They're not really part of the public consciousness. So then, because this is the public awareness, most of the time, that's what people think about when they think about homeless. And then it becomes also the political and the policy issues focused on this group, rather than talking about, the larger economic issues. It's one of the go-to strategies in governments that aren't willing to invest in public and social issues to the extent that we need them, which is, a fundamental problem we have in this country, is to try and define a problem as an individual problem rather than a social or economic problem. And so the focus on people with on the street with mental illness and addiction makes that an easier argument to make. You see, it's because they're addicted or because they're mentally ill that they're there. It's not anything to do with our system failing them. So, but your point is very, very well taken, which is, and it highlights the fact that this is primarily an economic problem and a problem of wages and affordability of housing. I'll tell you the scale. I just became aware of myself just a couple of weeks ago. There's a big group in the United States called the Corporation for Supportive Housing. And they are a kind of a broker and a developer of housing, especially for people who are homeless and mentally ill, what they call permanent supportive housing. So they're celebrating their 30 years of working. They were founded 30 years ago. And they said that they had been involved in creating 350,000 units in these 30 years, 350,000 units. If you look at the data from when Reagan took office, we used to build as a country through HUD 350,000 units of public housing a year, each year. That's what we were doing. And that went down by about 75% and has never gone up, not through Clinton, not through Obama, not now. No one's talking about building public housing in America. They're talking about giving away vouchers, but we're not really fixing the core issue of the problem. So, do we have a housing shortage and a housing crisis? It's enormous what's missing in terms of where are these families going to go? And no one's talking about that. So thank you so much for bringing that up.
Yeah, that was a really good point, ladies. This just makes me think of a statistic that I like to tell people, because I think there's a really common narrative where people are like, well, if we just gave unhoused folks jobs, it would solve the problem. But I think at least in the Pacific Northwest, I can't remember if it's Seattle or Portland specifically, the statistic is like 25% of people who are homeless work full time.
Right. That's right.
And like that, I think directly ties to kind of this thought of there's a lot of invisible things at play that people want to ignore.
Yeah. And something that that I've seen here in Atlanta, it's I'd be walking or driving around the city and I will see, homeless people in the streets. And for, I don't know, a couple of days, I will see the same people in the streets. And then it happens that one day or 2 days or 3 days in a row, they're not there anymore. And sometimes, I wonder, like, what happened to them? Did they got an opportunity to be in a shelter? Did they get an opportunity to get a job? Or, unfortunately, as human beings, we also think on the bad things like, oh, what happened with that person? Like, that lady that was walking with a child, or that guy who had crutches, but they were in a really bad state. Like, what is his fate? Where is he going? Things like that. And then you see them again in a different part of the city, and you fall back into like, oh, they're still in that condition. So I can relate to that sense of like, there's so many things that are invisible just to the naked eye of, they're not just people in the streets, it's just so many other things that happen around them that are the real factors of why their circumstances they're living in. And how come people can just fall into that and still have all these other things happening in their lives, like Sophie were saying, like there's people who have jobs who earn money, but they still fall into this homelessness. And it's just incredible that a lot of people just give the cold shoulder to that situation. It's something that it's I don't know, it always intrigues me how I go and see in a corner there's 3 or 4 of them, and then the next day they're not, but then I find them in a different part of the city. And I also know that sometimes police relocate them you know, they just come and say, hey, you cannot be there, and they're forced to leave. And I've seen that, and it's a little sad because they're just there. They're not begging. They're just probably, you know, resting from a long day walk or anything, and they just, you know, law enforcement also plays a part, that they just come and say, hey, you cannot be here, you need to move.
From a public health perspective, I think Sam is so right, because the largest group of people in homeless shelters are babies in the United States, and no one knows that.
Mm-hmm.
And from a public health perspective, we're really setting up ourselves for a pretty dismal future for hundreds of thousands of kids. And actually, if we lose Roe, this is going to get worse, much worse. And it's not something that we pay a lot of attention to. So I think if people are looking for areas of public health and the intersection with homelessness, the street homeless population for sure, and there's lots of great literature on what those comorbidities are like for them, but there's not much work about these babies. The work that there is does show that they are less healthy than other babies on Medicaid, and that continues through their life. So the public health intersection with homelessness, I think, is much bigger and broader, as Sam was saying, than we may see from what we read in the newspaper or hear on the news.
I feel like, oh, go ahead, Soph.
Oh, no, you go, ladies. I'm going to wrap us up once you're done.
Okay, I was just going to say, I feel like a lot of the narrative that I personally have seen just around homelessness is like, at least like, you know, who are the ones that are kind of addressing homelessness, the visible homelessness that we talk about. I see a lot of like religious organizations really involved in like that, you know what I mean? They take that on as like their narrative, like we feed the homeless, we clothe the homeless, and that kind of approach. And I always kind of wonder too, when I think about, I see those in the churches and all that stuff that they talk about, because they are such big players in public health work. How do we shift, I guess, their approaches and like work with them to tackle these more like systematic issues and provide actual housing, not just the temporary Band-Aid thing. So I think that's another big piece that Sammy touched on a little bit about, like consensus building, like working with all of these different partners in these groups to tackle like the root cause. I think they're a big key player.
Yeah, no, absolutely. There's definitely a place for that. And I agree with you that ultimately the solution has to be housing, but that what you just said about to see people, maybe that's the takeaway. That's, you know, and also in small way answers Diego's question. You know, one of the things that people say after they're housed, and you say, how you know, how are you doing? And it's, you say, well, I have finally forgiven people for walking past me all those years I was homeless on the street and no one would look at me. And so just that seeing someone and acknowledging their humanity and that what they're suffering through is a great start for, you know, removing the disconnect between us and them.
I think that is the perfect note to end on. So I just want to thank everyone so much for coming and staying to have this really great discussion. On behalf of Rollins, Michelle wasn't able to stay, but on behalf of Rollins and Orange Sparkle Ball, we just want to say thank you again. And we will note that our next session will be on Public Health Plus advocacy, and that will be happening in February. So we are taking January off. And we hope to all see you then, and encourage everyone to connect and get involved, and hopefully continue this conversation beyond just this webinar. So thank you all so much, and I hope to see you all again later.
Thanks, Sophie.
Thanks.
Nice to be with you.
It was great to talk to you, Sam.